name is Andy. I'm an RN Care Coordinator, and I just want to thank you for partnering with Peace Health for your healthcare needs. If you are watching this video, it means that either you or your loved one has recently been diagnosed with type 2 diabetes, also known as diabetes mellitus. In this video, I want to introduce you to the difference between an acute versus a chronic condition. We will review briefly the different members of your diabetic healthcare team, as well as the effects of diabetes on your body, both short-term and long-term. We will talk about the 3 most common things that increase your blood sugar, and then some standard monitoring that is very important to managing your diabetes. Before we go, I want to introduce you to an incredible resource that has helped many patients improve and effectively manage their chronic condition. The acute condition typically resolves with medical treatment or your body's natural immune response and doesn't last very long. Here are some examples. A broken wrist. When you break your wrist, it happens suddenly. You go to the hospital and receive medical treatment. Then 4 to 6 weeks later, your wrist would be healed and you would return to life as usual. Sudden onset, medical treatment, short period of time. Another example would be catching the flu. Someone shares a flu bug with you and 24 to 72 hours later, you start having symptoms. Your body's natural immune response activates and starts fighting the virus. It resolves within 2 weeks and you return to life as usual. Sudden onset, natural immune response, short period of time. A chronic condition is very different. It is marked by a long duration with frequent recurrences over an extended period of time. Diabetes is a chronic condition. It's not a one-time treatment and then go on with your life as usual. A chronic condition lasts a long time and is more like a journey. And like all successful journeys, it requires a team. And we at Peace Health have a dedicated team of professionals to help educate, support, and encourage you on your journey to healthy living with type 2 diabetes. Let's review some of the members of your diabetes healthcare team. Your primary care doctor. He or she will be working closely with you to manage your overall health. They will also make sure your medication and your treatment plan is working effectively for you. Your diabetes educator. They are experts in all things diabetes and will be working alongside you and your doctor to train and equip you to manage type 2 diabetes effectively. Care coordinator. These are licensed RNs or LPNs who are specially trained in chronic disease management. They work alongside your doctor and diabetes educator to support your type 2 diabetes healthcare needs. MSW Care Coordinator. He or she is specially trained to support patients with chronic conditions. They are experts in resources that are available to assist with patient medications, doctor visits, and other diabetic supplies if and when these things become a financial hardship in managing your type 2 diabetes. In simplified terms, type 2 diabetes means that our body is no longer able to manage all the sugar that's in our blood. And too much sugar in our blood can have the following short-term effects. Frequent urination. This is because the kidneys are trying to remove the excess sugars through the urine. Thirst. Because you're losing a lot of fluids, it causes increased thirst. Tiredness or fatigue. Sugar is like the fuel for our bodies in our blood. You would think that having too much sugar would give you a lot of energy, but it actually makes you more tired and fatigued. Other symptoms include blurred vision, frequent infections, cuts that don't heal, dry, itchy skin, or burning and tingling of the feet. Now, some of you with type 2 diabetes may have a few of these symptoms. Some of you may have all of these symptoms. And some of you may have none of these symptoms. But the important thing to remember with type 2 diabetes is that when your body has too much sugar in the blood, it does damage to your blood vessels. Poorly managed type 2 diabetes over time can destroy the smallest of these vital blood vessels in our body and can cause the following long-term effects. Long-term effects on the eyes causes blindness. Long-term effects on the kidneys causes kidney failure. Long-term effects on our heart causes heart failure or a heart attack. Over time, it damages our nerves and causes very poor wound healing. This means that a simple cut on your foot could lead to a foot amputation. As you can see, it is vitally important to keep the amount of sugar in our blood close to a normal level. Now, this brings us to the 3 most common things that increase your blood sugar. The first one is, you guessed it, food. What we eat and the amount of food we eat affects how much sugar goes into our blood. It's not just candy and sugar itself that can overload our bloodstream. Other foods can do this as well. Simple carbohydrates like potatoes, bread, and pasta all turn to sugar very quickly in our bodies. Number 2, lack of physical activity. Physical activity is what uses up sugar in our bloodstream. If you have a job or a lifestyle that involves very little physical activity, it produces increased sugar in your bloodstream. It's kind of like filling up your car with gas multiple times a day and only driving it for a short period of time. What happens to all that fuel? It keeps piling up. This is the same thing with the lack of physical activity. The sugars keep piling up in our bloodstream. Number 3, stress. Stress actually tells our bodies to put more sugar in our bloodstream. We have the same physical response when we are in a life-threatening situation. For example, if you're walking in Australia by a river and a crocodile comes out toward you, your body would get a burst of energy from sugar being dumped into your bloodstream. This gives you the ability to either fight the crocodile or run away from it. Either physical action uses up the sugar in your bloodstream. This is called a fight or flight response. However, if we have a stress response and we're not fighting a crocodile or doing something physically active to use up the sugar, this results in increased blood sugars. So as you can see, our eating habits, physical activity, and stress level play an important role in our journey towards healthy living with type 2 diabetes. At this point, I want to introduce to you some standard monitoring that is very important to managing your diabetes effectively. Checking blood sugar. It is important to check your blood sugars as often as your doctor prescribes, writing them down to bring to office visits with your doctor, diabetic educator, or care coordinator. This allows them to monitor your treatment plan and its effectiveness, as well as to make adjustments to it if needed. Blood pressure. It is important to check your blood pressure as prescribed by your doctor, keeping a log of it, and bring it to your office visits with your doctor, diabetic educator, or care coordinator. Having a healthy blood pressure is very important to managing type 2 diabetes. Annual doctor visits and routine labs. It is also important to attend your yearly checkup visit with your doctor to review the progress of your current diabetes treatment plan. Your doctor will also be checking certain labs throughout the year to monitor the effects of diabetes on your body. Routine foot checks. As was mentioned earlier, the effects of diabetes can cause numbness to your legs and feet. It is important to check your feet daily for any cuts, wounds, or calluses, because with type 2 diabetes, even a small cut or wound on your foot can be dangerous. Routine eye exam. It is important also to get a yearly eye exam to check for early signs of complications and to help prevent loss of sight. If you have any further questions about these procedures or need more information about them, please ask your doctor, diabetic educator, or care coordinator. The last thing I want to share with you is a resource that has helped many people with type 2 diabetes to live healthier lives and become better self-managers of their chronic condition. It is an incredible workshop that's called Living Well Alaska. Many of the habits that you have made with your diet, physical activity, and stress level have developed over a long period of time. Adjusting these takes training, practice, and time. This workshop specifically helps support you in adjusting these lifestyle changes. I encourage you to sign up for the workshop with the number below. We've covered a lot of basic information about type 2 diabetes in this video. We looked at the difference between an acute versus a chronic condition. We've talked about your diabetic care team and the different roles and support that they can offer to help you effectively manage type 2 diabetes. We looked at the effects of diabetes on our body, short-term and long-term effects, as well as the 3 most common things that increase our blood sugar. And then we reviewed the standard ways to monitor type 2 diabetes. Finally, we introduced you to Living Well Alaska Workshop, which is a great resource to support you in your lifestyle changes. And as we go, I want you to know that we at Peace Health are committed to walking this journey with you.